this is real hormone mastery. I really mean that. I find that if you can kind of wrap your head around things like sex hormone binding globulin, understand what it is, what it does, and can it help guide your dosing and administration recommendations, and I believe thoroughly that it can, and I'm not the only one who believes that, by the way. I think it can make a world of difference because a lot of us, we're busy. We're solopreneurs. We're single business clinic owners. Maybe we're working for a really busy clinic. We just need to be able to kind of quickly come up with these things, okay? SHBG tends to be one of the best ways to help determine dosing, especially when it comes to testosterone for men and women. All right, guys, Nico here. Sorry, the lighting's a little dark right now. I'm changing some things up. I'm going to do my first kind of like real official YouTube video, not like a podcast video, because I'm going to be using this guy. I'm going to draw something with a marker. I've got multiple camera angles. Camera 1, camera 2, camera 3. Pretty sweet. So let's do this. Let's give this a try. I want to talk today about sex hormone binding globulin, or SHBG. So remember, sex hormone binding globulin is a protein and it binds sex hormones. For any of you who have never heard about this before, bear with me here, but I talk about this all in the master course. So let's hop over to camera 3. Okay. So quickly here, SHBG, or sex hormone binding globulin, is exactly, again, what the name sounds like. I can't spell. Binding globulin. Or we call it, again, SHBG. This is a little protein primarily made in your liver, believe it or not, and it does a lot of the binding effects that we see take place in the body. So again, number one, it kind of acts a little bit like a terrorist and takes hostages. But number two, it also has some benefits. It kind of acts like a taxi, and it shuttles hormones around. Okay, so it has a love affair with androgens, male hormones, right? Or male-like hormones. So specifically testosterone and dihydrotestosterone. So you need to know that because it's going to make a huge difference when you're seeing patients, especially male patients, you're getting into TRT and stuff. Maybe you're already into that, but you don't know about this. It is really important, in my opinion, to test for sex hormone binding globulin in the serum because it does help you in one of two ways. Number one, it can help you determine dosing. And number two, it also kind of acts like we call it secondary metabolic biomarker. Okay, so I like SHBG for those reasons there. Let me flip over to another page here, and I'm going to describe why I like it so much. So let's say we got a 65-year-old male. We'll call him George. This is, by the way, a real patient that I had. That's not his real name, but 65-year-old male. His name's George. Healthy guy, otherwise pretty fit, feeling fresh. However, bad news bears. He's got all the symptoms of low testosterone. So what's that look like? Well, we all know what low T symptoms look like. Low T, so he's got a, zero drive. He's got ED. He's tired all the time, right? He goes to his primary care. Primary care checks his total testosterone. And what does primary care get? It comes back at 997. Holy smokes. That's like off the charts high. Wow, incredible. And so, you know what he says to poor George? He says, George, you're fine, dude. It sounds like you're depressed. Maybe take an antidepressant. George says, no way. George comes and sees me, Nico, and he says, Nico, I got a total testosterone of 997, but I feel like it's low testosterone. Help me out. So I said, George, did your primary care check a free T or an SHBG? No, he didn't. Okay. So here's two things I want you to do right now. If you're getting into testosterone replacement therapy and hormones in general, don't just check a total testosterone. You also need to check an SHBG. That's my favorite way to do it, okay? Because if you check both of those, you'll then be able to calculate your free testosterone. And real quick here, remember, total testosterone is like how much gas, so this is a really just god-awful looking car. It looks kind of like my car. Remember, total testosterone is how much gas you have in the tank of your car. Free testosterone is, of all the testosterone that you have in the tank and the engine, how much of it is actually available in the engine for your body to use. I know it's not the best analogy, but bear with me there. Okay. So free testosterone is really telling us about symptoms of low testosterone. Total testosterone, again, it's just saying how much gas you have. You can have full tank, you have a quarter tank. It doesn't really matter. Is the car going to start? Right? And that's based off of free testosterone. I'm not going to get into this whole calculation, but essentially, you can just Google free testosterone calculator, and you'll find hundreds of them all over the place, okay? But most importantly, what you're doing in that calculation is you're taking your total testosterone and more or less subtracting it from sex hormone binding globulin to get free testosterone. Okay, so again, George's total testosterone, 997. Holy smokes. But I test his SHBG, and guess what? That comes back at 115. Whoa, that's super high too. Ideally, it would be somewhere between like maybe 25 and 35, maybe a little lower, maybe a little higher. He's like way above the reference range here at 115. That's crazy high. And guess what that's doing? Well, let me show you. When you have a really high sex hormone binding globulin, and yes, I'm going to struggle to take this paper off. When you have a super high SHBG, imagine this. SHBG, remember, it looks like a Pac-Man, okay? I'll give it a little eyeball too. It's like a little Pac-Man, and it gobbles up testosterone molecules, okay? So you've got all these little testosterone molecules floating around your bloodstream, and here comes a whole bunch of these freaking SHBG molecules, proteins, right? And they're gobbling up all your testosterone. So if you have a lot of SHBG, it's going to bind up and take over all these testosterone molecules. You're not going to have any left for you to use. It's going to be bound up. So remember, George had lots of testosterone, right? It's there. It's just bound up. He can't use it because his SHBG was 115. Ouch. No bueno. Okay. So that's the kind of stuff we run into in clinics. These older men, especially as you age, it's normal to see an increase in sex hormone binding globulin. It's part of the reason why a lot of guys don't look the way they look, outside of many things. But we can do something about that, okay? And believe it or not, you can give George testosterone replacement therapy because he has such an elevated SHBG. Now, there are other things that cause an elevated SHBG, and I talk all about that in my HRT University Master Course, but I digress. So he has an elevated sex hormone binding globulin, has a high total testosterone, but guess what? When I tested his free testosterone, or rather when I calculated it, his free testosterone, we call it free T, came back at 6. Okay, it should be something like 20 to 40. That's usually where I see most guys are kind of optimally performing with a free testosterone. His testosterone was 6. That's super low. Okay, so what are we going to do for poor George? How are we going to overcome this elevated sex hormone binding globulin with a total testosterone of 997, but a free testosterone of 6? Well, we're going to give him TRT. Okay. Now, again, there are other things that we could be doing to help lower this SHBG, but the guy's 65 years old. His liver's done for, so to speak. He's old, right? He needs testosterone, and we can give that to him. Why? Because when I give him testosterone replacement therapy, say in the form of testosterone cypionate, right, which is injectable testosterone, I am now going to insert lots more testosterone molecules. So much that no matter how much SHBG George has, it's all going to be saturated by all the testosterone. And guess what? I'm going to have enough left over for George to use. Woohoo! Yay for George. Okay? Does that make sense? So we are actually utilizing testosterone replacement therapy in this way to overcome this elevated sex hormone binding globulin. And what you'll find is that this SHBG will actually decrease over time. It'll probably drop to 75, then maybe, 50, And it could drop a little bit lower, could remain right there, but that's much better. We've got more free testosterone available, which means we're going to have less symptoms, right? And that's exactly what George is going to say. He's going to say, oh my gosh, I feel so much better, Nico. Thank you so much for giving me testosterone replacement therapy. Now, this is where most people get super tripped up. And again, I'm not going to like belinger on this forever because I talk about this in the course in great detail, but let me just kind of describe to you again where people mess up a lot when it comes to dosing, right? So it always depends on the SHBG to some degree. It's not the end all be all, but SHBGs, I think, in my humble opinion, is one of the best ways to really help determine what is the right dose for a male, or a female. So if we have an elevated SHBG, rule of thumb is you want to give a high dose of testosterone, like testosterone cypionate or cream. It needs to be a higher dose. If you have a low SHBG, right? We don't have a lot of Pac-Men floating around. We want to give a lower dose of T, say cypionate, for example. Okay, so whatever the SHBG is, if it's high, testosterone cypionate dose should be high. If it's low SHBG, the testosterone cypionate dose should be lower. What do I mean by high? I mean typically something like greater than 150 milligrams per week. Okay, and if it is low SHBG, and when I mean low dose, I'm typically meaning less than 150 milligrams per week. Again, huge ballpark here, guys, but this is helpful just to kind of get an understanding of what I mean by that. Now, I'm a big fan of, again, splitting the dose. So when I say per week, I usually mean in, split dosing. With a high SHBG, I typically recommend doing 2 times per week injections, right? So if we divide 150 milligrams, right, that'd be 75 milligrams twice weekly. Okay. If we meant that we wanted to give someone with a low SHBG a lower dose of testosterone cypionate, we actually want to increase the frequency of injections. Okay, so this is confusing now, guys. Let me clean this up a little bit here. Okay, so if we have high SHBG, we want to give a big dose of testosterone cypionate, bigger dose, but we want less frequent injections. Why? Because we want a little bit of a bolus effect. Okay. If I have a lot of SHBG, say this is SHBG, I have a whole bunch of it up here, I'm going to need to get my testosterone levels up here, something like that, right? Twice a week, so that I can actually overcome the amount of SHBG. And when I get to this peak here, I'm going to saturate all that SHBG. I'm going to have more free testosterone available, which means I'm going to lower over time that SHBG. Does that make sense? Now, let's say I have a really low amount of SHBG. Well, now what I want to do, in fact, is give really small doses more frequently of testosterone cypionate. So that might be, every other day dosing, or maybe even at least minimum 3 times a week dosing. Okay. That is really, really important because this is going to dramatically change the way a person feels. Let's look at the opposite here, okay? I mean, let's say I have a guy, I'm like throwing papers all over the place here. And by the way, for those of you who don't know, yes, I am getting a little bit of a contact high from these markers, and I like it, and it's probably terrible for your hormones. So I'm going to need to figure that out. Anyways, I digress. Let me kind of just describe to you real quickly, okay, why we want to do frequent dosing or infrequent dosing to some degree. Now, I think most men ultimately are going to do better with frequent dosing than infrequent dosing. But for some guys, if they have a really elevated SHBG, like poor George, at something like 115 or higher, it's pretty high. A twice weekly dosing could be really helpful because, again, what we're going to get with twice weekly dosing, let's say we have 1, 2, 3, 4, 5, 6, 7 days in a week. Twice weekly dosing is going to look something like this. Okay. So we've got our peaks and we've got our trough and we've got our peak and we've got our trough, and it just resets. Now, here's what's interesting, right? Let's say the feel good line. Nico Misla feels good when his testosterone is right at this line cutting through here. Okay. Well, this is pretty good. Most of the time, we're going to be existing somewhere around that line, right? However, wouldn't it be better if I could get more consistency? What if I could get as close to that line as possible all the time? Wouldn't that feel even better? And I'll tell you, anecdotally speaking, because a lot of this is still kind of, we've never seen this in the literature, a lot of guys feel better when we do more frequent dosing, especially guys with a low SHBG. And it makes perfect sense. Okay. Again, if we have really high SHBG, we have to overcome that somehow and get these big peaks so that we can free up more testosterone. If we have a really low SHBG, say something like 10, that's freaking low. Okay. We don't have all these Pac-Men, right? We maybe have one or two floating around, but we have all this excess testosterone. Well, we don't want way too much testosterone in terms of free testosterone. Now we just want these little bumps, bits and bumps here, okay? So that way these guys feel more steady state and more stable. Okay, so once you understand SHBG, I'm telling you guys, once you understand SHBG for men and for women, man, does it make life a whole lot sweeter. This is real hormone mastery. I really mean that. I find that if you can kind of wrap your head around things like sex hormone binding globulin, understand what it is, what it does, and can it help guide your dosing and administration recommendations? And I believe thoroughly that it can. And I'm not the only one who believes that, by the way. I think it can make a world of difference because a lot of us, we're busy. We're solopreneurs. We're single business clinic owners. Maybe we're working for a really busy clinic. We just need to be able to kind of quickly come up with these things. Okay. SHBG tends to be one of the best ways to help determine dosing, especially when it comes to testosterone for men and women. Okay. The same is true for both. Again, you'll never go wrong with more frequent dosing, generally speaking, but in certain cases where we have a really, really high SHBG, we want to consider infrequent dosing. Infrequent dosing in my world is 2 times per week, never less. Once a week is going to be too little. Okay. Once a week, we're going to get this really, really, really big bolus effect and then this really long trough effect. And again, you're just not going to feel very good all the time. It's going to be either too much or almost too little. We want, again, something more like this or something like this. That's where most men and women are going to feel better, when it's a little bit more consistent. But we have to take into consideration the SHBG, because that could make us consider a slightly different dosing schedule. Okay. So I hope this was really helpful for you guys. Again, I break this all down in the HRT University Master Course in great detail. Guys, there's a reason why we want to learn this stuff. It's because our patients are begging for it and they want us to become good at this because they want to feel good. And if you go to just some regular old T clinic and they're just giving you big old doses of testosterone once a week with an anastrozole or a Remedex or some freaking AI, a lot of these guys are not going to feel that good. They're actually, it might be a little better than where they were, but there are some guys, I'm telling you, they get, puffy, swollen ankles and legs, and their blood pressure goes through the roof and they just feel like crap. And it's because they likely have really low SHBG and they're getting really big doses, and vice versa. Some guys, they go in there and, their SHBG is through the roof and they're not given enough testosterone. They're only given like 120 milligrams a week and they just never feel any better because it's not enough to overcome the problem, which is the elevated SHBG, right? So anyways, guys, I know that's a little bit of a crash course. I know it's a lot of information in a short amount of time, but I hope this piques your interest enough to consider, hey, I need to look into this more. I need to become masterful at this. Rewatch this video a few times if it helps, but definitely consider jumping into the master course. I promise you, it is worth its weight in gold. It's tremendous. I made it just for you because I love you and I want you to be amazing at this so that your patients can have a great outcome. Okay. Thank you guys so much, and I'll see you in the next one.